So now we're going to go into our last presentation about living a balanced life. This is the Live track. We have Dr. Dan Fazio, obtained his degree in chiropractic and acupuncture at Logan University in Missouri. In 2009, he founded his medical practice, e4e Health and Wellness. By using functional medicine techniques, he identifies the underlying causes of medical issues and provides holistic medical treatments that enable patients to take charge of their own healing. And I have to confess that I visit Dan once a month. Been doing that for about the last 10 years. And he is my wellness doctor and just performs miracles. And many of us in this room also visit him from time to time. So please welcome Dan Fazio.
Thank you for the introduction. Hello, friends. Good to see everybody. Today we're going to be discussing 5 effective strategies for stress management. I've been blessed to be part of Experts for Entrepreneurs for quite a while now. And if we do a word search over the videos in our archive, in our library, you would see that stress makes an appearance in over 30 of my presentations.
Wow.
It's because it's such a central fixture in our lives and challenge for our wellness. But the other amazing thing is it can be a wonderful motivator for performance. So let's talk a little bit about stress. It wouldn't be complete for me to stand up here with my background and not give you a little bit of anatomy and physiology. So I'll start by saying our anatomy work today is going to be pretty minimal. We're going to look at the anatomy of stress. The physiology is a little more in depth because our stress response in our body is a complicated process, but it can be leveraged for good. So let's dive in there. Here's the anatomy of stress. The gap between the demands of a situation and the resources to deal with that situation. It's that simple. The anatomy of stress is literally that gap between the resources on hand and the demands of the situation. Now, in certain circumstances, there can be a high level of stress, and we'll learn there's 2 types of stress, constructive stress and more destructive stress. But I'll say, depending on that gap, the level of response necessary for the body varies. So, anatomy of stress is just that, the gap between the resources on hand and the demands of the situation. Physiology, a lot more in depth. Physiology of stress is when our body is stressed, we release hormones. A couple of those stress hormones that are most well understood and studied are cortisol, stress hormone that boosts our blood sugar and gives us energy to respond to a situation. It's also an anti-inflammatory compound. It's a miraculous compound. But when elevated for long periods of time, it can be challenging for our body. Adrenaline-based compounds are the other things we think of, and that's what gives us the feeling of a rush of energy whenever we're presented with something stressful, okay? And what occurs in the physiology of a stress response is when cortisol is released, when those adrenaline-like substances are released in the body, our heart rate increases to pump blood to our brain, our extremities, our muscles, if we need to make a response, a true fight or flight type situation. Our heart rate quickens and blood is pumping. At the same time, our mental acuity increases and we're ready to respond to the circumstance. The things that get down-regulated are our digestion. That's the reason why a nervous stomach exists, even when it's a good stressor. Standing in front of all of you, this is not super stressful, but it's a little more stressful than when I was sitting there taking in all the good information I've learned so far today. So our body shifts into the responsive mode and out of a restorative mode, if that makes sense. So the understanding the physiology of stress just means appreciating how the body is gearing up for something rather than gearing down for a restoration process. At the very bottom, I say there are 2 distinct types of stress. Let's explore that a little bit. So the first is eustress. And when you hear eustress, it's EU and stress put on the end of it. Eustress is the positive type of stress. Well, a presentation, like I'm lucky enough to be giving right now, is a eustress experience. I'm challenged, but I'm able to come up here and share. I'm meeting my mission to help individuals, and it becomes a collaborative process. This is a motivating and energizing energy. And the other type of stress, distress, is more of what's considered negative stress. And this is overwhelming and exhausting. Now, the interesting thing is, if we go back to my definition of the anatomy of stress, that gap between the resources on hand and the demands of the situation, there are certain times that I've identified personally that I took a more distressing response to something that if I would have taken time to really analyze the situation, it could have been a eustress situation, right? And so understanding stress in that regard, so many of the past conversations where I've talked about stress, I've introduced the idea of adaptogens, compounds that can help your body adapt towards stress and respond better. Mental health practices like meditation, yoga, these sorts of things. Very important, wonderful things, but these are all considering the effects of distress mainly. When we can stop and analyze ahead of time and recognize that we can shunt things over and many times to that eustress category through proper planning, we sit in the seat of empowerment. Does that make sense? So let's talk about stress acting as a motivator. This is when we consider eustress, it is just that. It's a motivator, it's something that causes us to rise to our best self. This is pushing us to focus and perform better under pressure and heightening our awareness and responsiveness, our concentration. I'm going to mention Abraham Maslow's hierarchy of needs. Most everybody in the room will be familiar with this, I'm sure. It's a founding principle in psychology, and Dr. Maslow did his work understanding, it truly was positive psychology in the mid-1900s. The concept is, with Maslow's hierarchy of needs, that we have differing levels, foundational thinking in terms of how needs are met. And our most basic physiologic needs, the needs for food, water, and shelter, once met, allow us to then move on to some higher order needs. Now, it's not a pure theory in the sense that we do know that folks can access some of the higher order factors without having complete balance in the lower order. But all in all, it holds up, over 90%. The theory is fantastic. So first we have our physiologic needs. I'll say that if we don't have food, water, or shelter, we're in a state of distress. It's hard to imagine harnessing a lot of eustress in that situation, but a component that causes you to take action would be that. Once we get into safety needs, that's the next component, and that's actually where health shows up. So this is where I do a lot of my work for patients. If they come in and they're in pain, that is a very unsafe feeling because we can't execute on some of the most basic things important to our lives, taking care of ourselves and our loved ones. So safety needs is where I do a lot of my work. I look forward to elevating and helping people feel well, and then we can move up into the love and belongingness needs. This is community, this is connectedness, this is groups like this is our family, extended family and friends. And then we move up into esteem needs, executing on our businesses. It's great to be talking to a bunch of entrepreneurs because we spend a lot of time nurturing this area, working on it, and moving towards the self-actualization that happens when we're executing. So this is at the peak of the hierarchy. Self-actualization is actually representing this realization of our full potential. So we can see how we could be in those esteem needs spaces, dipping into some of that higher self-actualization, and how that there's an interplay between these highest level functions. But again, the theory stands, the basics need to be met first before we can give our mental bandwidth and that power over. So now that we have kind of a background and an understanding of stress from a concept of that gap between resources and needs, let's talk a little bit about 5 effective strategies to reduce the distress and maybe shunt ourselves over to and harness eustress as entrepreneurs. So the first one is time management. And the folks I'm blessed enough to know in this room know that this has been a challenge for me. As a doctor, it's difficult to give all of my attention to my patients. That's my one and only desire. And then also manage a busy schedule. So it's been incredibly helpful to have staff to help me prioritize my tasks, set realistic deadlines, and then that delegation out is the third component that I've learned, and I see this as commonplace to many businesses. That delegation piece is crucial. So the time component, comes first, then balance. And you'll see balance gets 2 slides. Everybody who knows my practice name, e4e, that actually means balance. So you're going to get 2 slides of balance. This is life-work balance, and it's not accidental that I say it like that. You often hear folks talk about the work-life balance, but I always put life first. Life-work balance is scheduling regular breaks and making time for hobbies, exercise, and relaxation. I love the medical building I'm in because every day around lunchtime, when it's nice out, like it is right now, I can look out and see groups of nurses and doctors walking around the building together, just doing laps at lunchtime. And that makes me so happy. That's that life-work balance. They're getting out, they're moving, and it's scheduled in. Some of them are really braving out there in the drizzle and the rain, too. The next component I'm going to discuss is boundaries. And spoiler alert, the next slide is all about boundaries. And this is because I've learned as an entrepreneur and one who loves to care for people that it's really important to manage these boundaries. And I learned it by not doing it really well. Found myself on family vacations emerging from the redwoods to 10 texts. And I want to respond to my patients. They're so important. But I also want to be on vacation, right? And so learning these boundaries has been crucial. And these boundaries can exist within an organization, right? In our interplay with other people. They exist within our life. They exist in order to have a dash between life and work, because that's where the boundaries come in that dash, that space in between. So with boundaries, I've just highlighted 4 points here. Developing self-awareness of needs, values, and limits. Okay? What in your work are your needs? What do you need to get out of your daily work in order to be satiated, satisfied, and in that 4th and 5th level of Maslow's hierarchy, where we're feeling that self-actualization, but doing it in a way that you can maintain. The second is identifying which situations are acceptable behaviors, actions, and situations that are allowable. So this is kind of looking back at one. What do I need? How do I want to execute on these values, and what limits need to be put in place? Then identifying the situations and how they bump up against those. Then communicating clearly what those boundaries are. This is communicating clearly within your team at work. This is communicating clearly with your clients, in my case, patients, and clearly delineating how others can interact with you. Because the desire in this room, I know, is to help and serve. That's what this group is all about. And so we want to learn how to best show up, but first we have to tell people how accessible we can be and when, and then how we're going to help meet their needs if we aren't accessible. The next is enforcing those boundaries, and that really just comes with consistent messaging. Anybody in the room that's a parent or takes care of kids they love, nieces and nephews, knows that it's all about consistency and messaging with boundaries. And this is enforcing those boundaries just through that consistent action. And remember the last part, and I have to remind myself of this all the time. Boundary setting is a skill, which takes practice, like anything else. So the next component we'll talk about is the lifestyle piece. Healthy lifestyle choices, again, of the 30-some-odd presentations I've been so blessed to make for this group, they are chock full of these lifestyle components, but we talk about exercise, mental stimulation, not just for health and what we call the wetware, the brain, mental stimulation also to keep things fun and exciting. Then nutritious meals, again, we have slides and slides in the archives regarding this, but we want to think about low inflammatory foods, plenty of hydration, and monitoring our sugar intake. And then sufficient sleep. Again, the circadian rhythm is our sleep-wake cycle and how our body reacts over the 24 hours that make up a day. That restorative component and having that sufficient sleep and high levels of that deep restful sleep each night, crucially important for your performance and stress management. This is my favorite slide of the day because this is what this group's all about. Support. Don't fly alone is our tagline here at e4e. And so seek support. One of the best ways to mitigate stress in my life is when I call my mentor and guide, Bill Pernat, and I run ideas by him because he's always got ideas and solutions for me, or a different way to look at a problem. This group is all about this, a network of professionals, mentors, colleagues, peers that you can bounce ideas off of. Anytime I open up to my chiropractic peers or functional medicine doctors that have questions or and seek advice, I leave with better clarity and never fails. There's a different way to look at things that I might have overlooked or missed. And then the last piece is, again, that stress management component. It's part of life. We're going to manage stress to shunt as much into that eustress, that positive stress category as possible, but we have distressing things that occur in our lives. Then it's about how do we best manage that stress that we have, much like time. If we don't manage it, it'll manage us. We'll stress. If we don't manage it, it'll manage us. So mindfulness, meditation, and prayer. Deep breathing exercises are one of the quickest ways to center the body and get it back into a relaxation response. We have a yoga teacher in the room, and a hypnotherapist who can help teach those practices. And the last thing I want to talk about, just because I want to drip a new idea out there that I've only mentioned once in front of the group, it's pretty contemporary. This is brand new. At times, we need a little extra help with stress or anxiety. And that's shown when we look at prescriptions that are written. There's a large percentage of the population that needs help with anxiety or depression, okay? And so no shame at all to get that extra help if it's needed as something as strong as a pharmaceutical drug. But now there's genetic testing that can actually help determine what the best fit is and what the dosing is. So no longer does it need to be a guessing game. Let's try this for a while, then let's try this. We can take a much more pointed approach. And then, of course, as a holistic wellness provider who doesn't prescribe, I love it that there's genetic testing advances now that allow me to test patients. It's as simple as a little cheek swab you do with the Q-tip, send it off, and the DNA analysis is done. A genetic SNP is what it's called. Single nucleotide protein. SNP testing is done and can tell you what compounds your body might be low on. So some of the supplements, that if you would just do a cursory Google search or an AI search, like I taught us earlier, if we would do a cursory search like that, we might see things come up like SAM-E, S-A-M, small e, is a certain supplement, or St. John's wort, or 5-HTP. These are all compounds that boost neurotransmitters. But we don't need, we all don't need the same thing there. Right. And trial and error has been the way we've done for a long time. Trusted advisors who do work in the sphere can often make good suggestions that are more pointed, but now we can actually do genetic testing for this. And I want to offer that because in addition to the mindfulness and the concept of managing what needs to be shunted over to eustress, what has to exist in that distress, we also know that we can rely on trusted advisors to be able to test and point us accordingly. So thanks so much for your attention, and I open up for any questions. John?
I had gone to a seminar a number of years ago when we got into stress, and they were testing us and doing different things along those lines.
Yes.
And it turned out that I have no stress.
No stress?
No stress. I am a stress carrier.
Okay.
I'm created for everybody. But I have no stress.
You're very fun. I know that you help people mitigate stress in their life.
Yes.
There's also one thing for people who probably are aware of it, I'm sure you are. Stress spelled backwards is desserts.
You're funny. I thank you for that. I actually never knew that dessert was stress back. But I do have quite a sweet tooth, to be honest. I love it. Thank you, John. Any other questions or comments?
This genetic testing that you're talking about, is that something that you do for all of your clients before you make recommendations about, because you're not able to recommend pharmaceuticals?
Correct. Yeah.
So how do you incorporate, because I know you're really good at the medical side of things as well.
Thank you.
And so you gotta obviously throw it out as a consideration.
Yes.
Talk to me a little bit about how you do that.
And thank you, Les. I appreciate that so much. So I operate in a space where I believe very strongly in integrative medicine.
Yep.
My choice was to go into holistic wellness, but I have so many trusted providers that I refer out to. In fact, my assistant spends most of her day with all of the referrals that go back and forth. Because what I promise my patients is that I'm going to act as a quarterback for them and make sure that they're getting what they need. Some of that I can provide, and sometimes I am that beginning end and can help them find that end solution. But more often than not, I'm having to co-manage.
Yeah.
And so what I will recommend when it comes to the testing specific to pharmaceuticals is I will send folks out for that. I don't conduct those tests or utilize my trusted providers. I do use the trusted providers. I have 3 different companies that I do diagnostic testing with. I use those and I facilitate that whole process for the natural things that fall under my scope. And that's an easy decision to make because it's
So the
really
results that come back will indicate what they ought to do rather than you having to say, this is what I think you ought to do or you're deficient or.
That's exactly right. Now, the fascinating thing, and this wouldn't surprise anybody in the room because all of our work involves some repetition. The first time you encounter, the first genetic test I ran like this, when it came back, I was fascinated by it. And I pored over it for a cumulative probably 8 or 9 hours. That's one patient. Because I was looking at these tools that I had used over the years and looking at them in a whole new light. Ways things were layered. The thought that, wow, I would have included a 3rd thing here. Now I'm seeing that's not needed. So was I pouring a little more water on the plant than it needed? That sort of thing. The second time I encountered it, same test. Took me about an hour. Now I can process one in about 15 minutes. And it's just because of the consistency. And I often will sit down with the patient and now say, I've run tests, genetic testing specific for this. Here's what I think you will likely need. We can go for confirmation. Or, if cost is a concern, because the genetic testing ranges between $200 and $400, depending on what somebody needs. If cost is a concern, we can go back to the old-fashioned way I did for 14 plus years and try this and this based on what I've learned. But if we want to get very granular and very specific, now it can be done.
Great.
Is that through a blood test?
No.
So it's actually a cheek swab.
Oh, okay.
Just the process, the insect, we're going to get a little technical for 1 second here. One of the tissue types in our body is called epithelium. Our skin is that, our lining inside of our digestive tract is that, and the inside of our cheek is called epithelium. It's a very fast turnover lining. We don't even realize this, but every time we chew, swallow water, anything like that, a little bit of that sheds off. So you can take a Q-tip that's on a long wooden stem, and you can just do a quick cheek swab. You wouldn't be able to see it, but you have some epithelial cells that are on that then gets sealed up and sent off to the laboratory. And they will get those microscopic epithelial cells and run the analysis on that. Now, there is more in-depth testing that can be done that also couples blood testing. And then, as we talked about in the past, I also do salivary analysis for hormone testing and have done it for years. And then I do extensive blood work and functional blood chemistry analysis. So we test just about anything. Hair tissue mineral analysis has been used in the practice, but the new genetic testing, cheek swab is how it starts. And then if we want some additional markers, you can go deeper with the blood component.
Let's give Dan a